Do you feel unhappy with the doctor that you currently have? Tell me if you can relate to the scenario that I'm about to explain. Yesterday, I was working at the hospital and I was working with a patient that was very unhappy. She was diagnosed with liver cirrhosis, aka liver cancer, and getting ready for a liver transplant, feeling very scared and hopeless. She said to me,
"The doctors give me different information all the time. One day it's this, and the next time it's that, and I have to dissect everything they say and put the pieces of the puzzle together myself. It seems like him and the team do not know what they're doing. I'm not sure they know who they are treating today. The doctors just give me medication without explaining to me what each medication is for, and sometimes they forget what medications I am taking that they prescribed. The doctors do not take the time to explain exactly what is going on with me, my laboratory results, diagnostic studies, and disease process. And when they do, it's not in the way that I understand. They are always in a rush. All of the doctors in my case do not communicate with one another. One doctor is doing one thing for me, while another doctor is doing another, and they are not aware of what exactly each one is doing. They need to talk to one another. The doctors are not honest with me about my condition, when I want them to just be completely honest about what is going on. How bad am I? If I'm not going to make it out of surgery? How long I'm expected to live? And what is going to happen to me after surgery? The doctors do not listen to what I want and know best for myself, but instead they push their ideas onto my health and quickly leave the room. I hardly see them.
do you relate to any of these statements, or have you heard other people express the same concerns? I understand that dealing with some doctors can be incredibly difficult, and I think it's because of three main problems. And that is, 1, communication styles. 2, present level of knowledge. And 3, availability of time. Before you chew me out for not personally knowing your personal struggle, I wanted to explain to you from my perspective, because I've not only had the time to listen to patients at the bedside in the hospital, but I've also had the opportunity to put myself in a doctor's position, as well as witness the routine from both sides of the story. At the end of this discussion, stick around, because I will try to tie the 3 reasons why dealing with your doctor is difficult for you, and also give you 7 healthcare tips to get the most out of your visit with your doctor you do not like, or just any doctor that you will be meeting with in the future. So let's review the first point, why dealing with your doctor can be incredibly difficult. And that first point is communication styles, which can be developed from childhood up until adulthood and influenced by personal life experience. Some people have passive communication styles. They like to avoid their own feelings and needs. They tend to be incredibly hard on themselves. They're excessively apologetic, always saying sorry. They have people-pleasing tendencies or rely heavily on the decisions of others for their own. And they avoid their own thoughts to avoid conflict. So this type of doctor will listen to you and give you everything you want to hear, even though they know that this is not the best for you, because they want to avoid confrontation. They do not have a fighting bone in them to tell you what you think is absolutely ridiculous. Some people have passive-aggressive communication. They like to express their thoughts indirectly rather than directly addressing the problem. So rather than saying exactly how they feel at that point in time, they will act out by giving you delayed responses. They will miss deadlines that you're waiting to get from them, and they will have very sarcastic and negative tones. So this type of doctor won't tell you that you're wrong, but they may appear as very short-tempered and give you minimal responses just to get you out of their office. And end up walking out of the office thinking to yourself, did what I say make any sense? And why did they have to be such a jerk about it? Some people have aggressive communication styles, where the person communicating expresses their feelings, their needs, their desires without any regard for the other person. This person speaks very loud in a demanding tone, focuses on the faults of other people, and uses you in a lot of their statements, and has a very short temper and a low tolerance for any type of frustration that they may be feeling. So this doctor has no problem telling you you're wrong and that you need to follow their healthcare advice, and can possibly tell you straight to your face, you're gonna get sick and you're gonna die from this. And then you're left feeling very scared and vulnerable. Lastly, some people have assertive communication styles, where the person expresses their needs and perspective in a very respectful manner. This means that the person will speak up about how they feel, but will not force their opinions onto you. They are very clear about what they say, and what they say is typically consistent from day to day. And they're courteous about the way that they say it, and do not wish the worst for you. So this type of doctor will listen to your needs, give you the facts about the current situation, and allow you to make the decision for yourself after back and forth debate in the office. Because after all, you're a capable human being. You can do research on your own, and you have opinions of your own that you want to share with your doctor. So this type of doctor is the perfect scenario. However, this type of doctor is the most time-consuming, which I will further explain later on in my discussion. So now that we've reviewed the different types of communication styles, which one of these are you and which one of these are your doctor? Keep it in mind while we move on to my next point. Next, let's review the second reason why the communication between you and your doctor may be difficult. And that is the present level of knowledge when you are face to face with your doctor. So the present level of knowledge means to me, what were they coming to explain to you? Let it be some lab results, diagnostics, or disease process that has gotten worse and needs more investigation, which would require A, B, and C testing or treatments. What the doctor can determine more of through research or discussion with other doctors or smart healthcare professionals on their own time. And lastly, what the doctor currently understands and has received about the big picture in regards to your medical case. Okay, why did I tell you all this? Let me break this down for you further. Why the level of knowledge affects the doctor's interaction with you. So unfortunately, you are not the only person that the doctor treats in any given day, week, or month. Doctors are human. They can forget about what they've read about your medical history because more than likely their brain is overloaded with the many other patients that they are treating, with the 8 to 10 years of medical school knowledge that they've had to cram into their brain, as well as the years of work experience and research that they have done to determine why they're treating you and what they're doing for you. They can see anywhere from 20 to 40 people in any given day in the office, which then again makes their time limited. Coming from you, a little patience and a reminder can help. Sometimes doctors cannot give a straightforward answer, because I'm sure that if they had the confidence to say, yes, this is black and this is white, it would be said. But your health changes day by day and is influenced by many factors like diet, stress, medications, time of the month, personal influences. Doctors are not gods. They do not know the biggest picture. Only a small fraction from what you say, what they clearly remember about you, if it sticks to their brain, and through past experiences, be it education or life experiences. Yes, they can forget things and have to be reminded. Just like how I forgot what I did last Saturday at 3 p.m. Do you remember? So yes, the answer from doctors can sound very wishy-washy. You are a special individual, not like anyone else, from that of any other person that they've helped. And they are anxiously waiting to meet with you the next time to see how you've been doing and if what they've recommended to you is working and how you've been handling your life. So in summary, doctors have a limited mental capacity, and the present level of knowledge at the time of meeting is limited. They are not gods. They cannot remember everything that they've read about you. They cannot remember everything that they've studied in their 8 to 10 years of medical school, even though I think they would love to. Heck, I would love to have an insane level of memory where anything I lay my eyes on gets easily absorbed. So they may need a reminder about what was done the last time you two met and what has changed in the present time since the last time. They are trying their best to put the pieces together at the time of meeting you when you ask them questions that they weren't expected to answer and end up having to pull it out of their memory. Which rolls over to my next point. Number 3, why your relationship with your doctor may be difficult. And that is availability of time. The average provider sees about 3 patients every hour, which means that they are allotted about 15 to 20 minutes per patient to meet with you, to listen to your concerns, address your concerns, and then present to you new findings and solutions. Then at some point throughout the day, if not immediately, dictate and write notes in your chart to make sure that they are in compliance with your insurance, their medical board, and you, if you're not pissed off and about to sue them for something that was said or done incorrectly because of their poorly functioning brain or overworked brain for that day. Also, at some point, make sure your prescriptions are sent to your pharmacy immediately because you're waiting. And if not, have to make changes to your medications because that old meeting did not give him or her the results that they were expecting. And in hopes that the next time you come to the doctor visit, new medication is actually working. Then, if they're not in the office with you, they're probably making their way to the hospital to meet with patients at the bedside or to perform a surgery. Somewhere in between, they have to get in touch with the other providers on your case, only if that provider is available to speak at the time that they have to talk to them. And they have to make time to think about what the next best treatment plan is for you or for someone who is nearly dying in the hospital, potentially meet with a family member who is upset or has a lot of questions to bring to their attention, and somehow catch up with the latest advancements in technology and medicine in today's evolving healthcare system. Now, I've only gone over the time that they need to allot for patients, but what about the time that they need for themselves? What about that 30-minute exercise that they should be doing daily for excellent health? Or at least 30 minutes for their breakfast, lunch, and dinner? Or that 30 minutes or 60 minutes that it takes them to drive from their home to work? Or even that 1 hour that they want to devote to their family or personal lives? Which means that if they sleep a minimum of 7 to 8 hours for good health, and they have a full day's meeting patients over the course of 8 hours, 15 to 20 minutes per patient, then they have to finish up their documentation, which takes about 1 to 2 hours during or after office hours or hospital hours, which makes the day just allocated to work 10 hours. Then they require 4 hours to at least work out, eat 3 meals in the day, drive to and from work, and spend time with family. It would mean that they have only an extra 2 hours to spare if the day goes according to plan perfectly. But we all know that things come up unexpectedly. And they can easily be sidetracked by that colleague that they ran into in the hallway that wants to talk for like 5 to 10 minutes, or the insane traffic in Los Angeles that held you back for an additional 30 minutes in your day, or some type of meeting that they have to attend with their administration board. So yes, if you feel like your doctor is in a rush with you or short with you, it may be because their schedule is overwhelmingly busy and they may be limited with their availability of time. Most doctors I know have to take their work home and allocate it to late nights or weekends to finish up, because they are too mentally exhausted and busy with their schedule. So now that I've explained what the provider can be experiencing on any given day, I want to focus now on you as the patient, the person seeking help. I get it, you're scared. You want to get better, and you may hardly know anything about the health sciences. And you want the doctor that you look to for all the answers to give you the right answer. Then again, they're challenged by their communication styles, that they've grown up that does not align with your communication style. They are forgetful human beings with limited mental capacity, and they don't have the quality time to talk to the doctors that are also on your case before the two of you meet, as well as devote the quality time to you, the patient, to the special person that you are. Because yes, indeed, you are just as much special as the next person and need special focused attention. Now, I want to give you back the power and let you know that you are more capable of being in control of your health than you think, and that the doctor does not have the final say in your health outcomes. Here are the 7 tips that I want to give you to make the best out of the next interaction with your doctor and for the rest of your life. Number 1, first, you need to organize all of the findings about your health, your life, like a research project. Put all of the information in a binder or a PDF and think about yourself like the most important research project of your life. Second, you need to think about your relationship with your doctor like a balance beam, where both parties hold equal weight. If he holds too much weight, you need to take on more weight by balancing the beam. And the goal is to be in equilibrium. It takes a lot of work from both ends. You need to think of the doctor as just one resource in your life, similar to a valuable book that you would read, but more valuable because it has hands and feet and a brain that can do things for you. The value of a doctor is appreciated by life and work experiences and years of schooling. So yes, allow your doctor to examine you. If it means looking at your body, taking some blood samples, ordering ultrasounds, CT scans, MRIs, because they think that you need to be further investigated beyond the naked eye, based on you coming to the office and presenting complaints. Now, what you do with the result or the information that's presented to you is really up to you. You can ask for advice from your doctor, take it or leave it behind, because again, the doctor may be functioning at a limited mental capacity and should only be treated as a resource for you. They really only know what they know at the time of the meeting, not more, not less, and present it based off of their communication style and within the time frame that is allotted. And I believe your intuition will tell you if your doctor is a good or bad person, because after all, they entered medical school in hopes of cramming a bunch of medical knowledge in their brain to present to you in the most efficient and effective way. So when their weight is not balancing the beam, let's move on to our third point. Do not take offense to their poor social skills. Again, they have valuable knowledge to extract from. They have the experiences, they have the facts, and they have the research. Maybe not so much time to hear how sad you are today or what you did last week on vacation, even though they have the biggest heart and they want to empathize with you. Number 4, help your teammate, the other person at the end of the balance beam, who is the doctor. Remind them why you're meeting with them so that the both of you can devise a better plan to keep the beam in balance. And if they don't make any sense, you can take matters into your own hand. Because again, you are an adult and capable of researching more about the valuable life that you want better for yourself and to save. Number 5, if you feel that your doctor is in a rush and being short with you, understand that there may be a good reason behind it or not. And you wouldn't benefit much from one-liner statements because you want to know about yourself in depth. And luckily, there's tons of resources out there. So number 6, how do you get to know yourself if the doctor will not explain it to you? You look the other way when you feel dissatisfied, and you take control of your life by self-studying about the most important person in your life, and that person is you. You familiarize yourself with a test the doctors have ordered for you, what conditions you may be affected by, the medications prescribed to you, and you utilize resources like books, the internet, YouTube, and other smart people in your life to take care of the most important person to you, and that person, again, is you. Then, the next time you meet with your doctor, you share notes and surprising findings that have and have not worked with your teammate, the doctor, and you execute, revise, or withhold. And all of this depends on one deciding factor, and that person is you. But you must not forget
your doctor is a valuable, experienced resource
that you can use for your own good or you can trash. They must have at least one piece of golden nugget for you to take home. 7. This last piece of advice is when all have failed you and you feel that your doctor is uneducated with no mental capacity, who only graduated from the worst medical school in history and has absolutely no idea what they're talking about, with absolutely no life experience, who is aggressive and can't seem to understand a single thing about humans. And that last piece of advice is to find another doctor who aligns with your ideals and research, whom you've heard about in your community through reviews, through a friend or family. Well, I hope this information finds you well and that you can find a doctor who is right for you in your medical journey. I hope that I was able to change your perspective to be more patient and more understanding. But if not, I'm sorry you have a shitty doctor. Take good care of yourself, because at the end of the day, nobody cares more about you other than you. And there's that famous saying that goes something like, putting yourself first doesn't mean you don't care about others. It means that you are smart enough to know that you can't help others if you don't help yourself first, because you cannot serve on an empty vessel. Bye!